Test, test,
Jesus, you have no idea.
test, test. Test, test, test. Test, 1, 2. 1, 2, test. Test, test, test. Test, 1, 2.
Check, 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 check.
Test, test, test. Test, 1, 2. Test, test, test. Your question. I think I answered your question.
Hey, hey, Kev. I'm fine. Yeah, I don't know if I'm supposed to accept them, deny them, whatever. I just keep accepting everything. So, uh, yeah. All right. Excellent. Appreciate it. Thanks.
I would like to invite all legislators to please take their seats, and for our presenters to please step up so that we can get started. The hearing this morning will last until noon, and then we will end at noon, as we have committee meetings scheduled to start at 1, so we need some extra time for caucuses. So if we can get the presentations themselves by the administration, it's going to be limited to 20 minutes, and then the rest of the time we left for legislators' questions. But again, I would invite all our presenters to come up and take their seats. Let's get started. I would invite Legislator Kennedy to lead us in the Pledge of Allegiance. Mr. Mike, could you call the roll, please?
Yes, sir, will do. Roll call. Deputy Presiding Officer Howard Copel. Alternate Deputy Presiding Officer Denise Ford. Legislator Sheila Bino. She's on her way? Okay, thank you. Legislator Carrie Solage. We'll come back to them. Legislator Deborah Muley.
Here.
Thank you. Legislator C. William Gaylord III.
Present.
Legislator Vincent Muscarella. Legislator Ellen Birnbaum.
Here.
Legislator Delia DeRigi Whitten. Legislator James Kennedy. Legislator Thomas McKevitt. Legislator Laura Schaefer.
Here.
Thank you. Legislator John Ferretti. Thank you, John. Legislator Arnold Drucker. Legislator Rosemarie Walker. Here. Legislator Joshua Lafazan.
Here.
Thank you. Legislator Stephen Rhodes. Minority Leader Kavan Abrahams.
Here.
Thank you. Presiding Officer Richard Nicolello.
Here.
Let me just go through, try one more time.
Legislator Muscarella is not joining us today.
He's not?
No.
Thank you, Rich. Legislator Carrie Solage. And Legislator Sheila Bino. She will be attending, is that correct?
I believe she's in the building. I think she's on her way.
Okay, thank you very much. And we have a quorum, sir.
Okay. Well, today's hearing is with respect to the CARES Act, the history of the 2020 expenditures under the CARES Act. Obviously, there's news this weekend with respect to additional relief funds from the federal government. I guess we could touch on that briefly, but it is to focus on the administration's expenditures during 2020 with respect to the CARES Act funds. I don't have a statement to read. I think it's more beneficial to hear the administration's presentation and then save as much time as possible for the legislators' questions. So I'm not sure who is going to lead things off, but I will offer it up to you guys. Just when you speak, just please, at the outset, please just state your name for the record.
Paul Broderick. Thank you. Legislators, good morning. I believe you all received copies of the presentation. Can you hear me fine? No. Closer to it. Yeah. How's that? Better? Better? This thing's hitting me in the nose now. Kev, how's that? Better? Better?
That's better.
There we go. I believe you all received copies of this morning's presentation. If not, please let us know, and we'll get that to you right now. Thank you for affording us the opportunity to discuss how we allocated various CARES funding. Introduction of the panel, we have Kevin Crean, who's Director of Office on Community Development, Inspector William Field, the Police Department, Director of the Budget, Andy Persick, and Deputy Director Phil Wasserman, and I believe Dr. Larry Eisenstein is joining us remotely. If you go to page 2 of the presentation, here's the agenda as we've laid it out. Nassau County COVID-19 response and recovery, a funding source overview. A second part will discuss FEMA reimbursements, testing and vaccinations, PPE, and then part 3 is the CARES Act funding. U.S. Department of Housing and Urban Development, Coronavirus Relief Fund, and other grant spending. Just bear in mind that the CARES Act is basically various funding sources within that umbrella act. If you could please respectfully hold any questions till the end, it will just make it a little bit easier on us. Thank you. To turn to page 3. Nassau County COVID-19 response and recovery. As you recall, on January 31st, 2020, President Trump declared a national public health emergency. And then, subsequent to that, on March 13th, the President declared a national disaster for COVID-19 under the Stafford Act, which established FEMA reimbursement for public assistance grants. Responding to the COVID-19 outbreak and its impact on the economy, public health, state and local governments, individuals, and businesses, Congress passed the CARES Act, a sweeping piece of legislation that, among other things, allocated funding through the various sources: Housing and Urban Development, Federal Transit Administration, Department of Justice, Health and Human Services, and the U.S. Department of Treasury. On March 13th, a nationwide emergency was declared, invoking the Stafford Act, which allowed public assistance from the Federal Emergency Management Agency, FEMA. Turning to page 4. This is a very fluid situation with FEMA. Initially,
I don't mean to interrupt you, but I don't know if the legislators and others tuning in remotely can see your presentation. So, Kevin, I don't know if you could put that up on the screen. Katie?
I emailed it out this morning a little while ago to all of the members that were on the Microsoft Teams.
Okay, so maybe just as a
someone
reminder.
if someone doesn't have it, please let me know and I'll forward it.
Okay, all right. And we could also put it up on their screens if Kevin could do that. Okay. All right, go ahead, Paul.
Yes, sir. FEMA expenses. Bear in mind, the initial period is 6 months normally. So it would have been from when the declaration was declared on March 20th through September. March 20th would have run 6 months through September 20th. More recently, it was extended indefinitely due to the uncertain nature of the duration of the pandemic and efforts to remediate. Initially, the county match was 25%, so whatever we seeked in reimbursement, we would have to cover 25% of the cost. And then that was recently removed by President Biden on January 21st, so now it's 100% covered by the federal government. As you can see from the chart, in total, currently we're seeking $26 million in recovery, which is basically broken down into a couple of categories: COVID-19 testing and contact tracing, medical expenses, payroll for public health and safety employees, personal protective equipment, PPE, public health expenses, and vaccinations. Now, the vaccinations figure there for $3 million is merely an estimate at this point in time, because once again, we don't know how long it's going to take to inoculate all the residents in Nassau County. Please turn to page number 5. So COVID-19 testing. Throughout the pandemic, Nassau County funded the operation of COVID-19 viral and antibody testing sites in hotspots and hardest hit impacted communities. Nassau funded testing sites ran by federally qualified health centers, FQHC, Northwell Health, and Mount Sinai South Nassau Communities Hospital. As of the 3rd of March, over 14,000 viral and antibody tests had been administered to residents from FQHC testing sites funded by Nassau County. Testing continues to be instrumental in containing the virus and protecting communities of color. With testing and education, Nassau County brought the high rates of transmission down considerably. And on the right-hand side, you can see the various locations of those testing facilities. Moving on to slide number 6. COVID-19 vaccines. Nassau County Department of Health runs 3 vaccine distribution centers located at the following sites: Nassau Community College, the Yes We Can Community Center in Westbury, and LIU Post. As of March 3rd, 2021, Nassau County Department of Health has administered over 40,000 vaccines, and the breakdown by priority groups is listed there. On the right-hand side, you can see the percentage of population with at least one vaccination dose. Nassau is amongst the highest, and this was based on information provided by the New York State COVID-19 Vaccine Tracer, and that was as of March 4th. Slide number 7. That indicates how much PPE the county had purchased over the last, I guess, several months, 12 months. Roughly little north of just about 1.7 million items were purchased, primarily in masks, gloves, personal protective equipment, and which was distributed to non-for-profits and hospitals. That was coordinated by Office of Emergency Management and assisted by the Police Department, DPW, and various other county agencies to county-wide organizations. If you could please turn to slide number 8. Now, the CARES Act allocated monies to various federal entities: Department of Justice, Center for Disease Control, Health and Human Services, Housing and Urban Development. For COVID-19 relief grants, established the Coronavirus Relief Fund. So that fund is an umbrella which encompasses funding to those other various agencies. There are unique funding streams. Nassau County utilized available funding sources to account for expenditures related to COVID-19 response and recovery efforts deployed countywide. Presentation will review these funding sources according to 3 major categories, and once again, they're unique funding streams: U.S. Department of Housing and Urban Development, Coronavirus Relief Fund, and other grants spending. The CARES Act was signed on March 27th. On April 15th, County Executive Curran submitted a request to the U.S. Treasury seeking funds and for remediation of COVID. On April 23rd, Nassau County received $102.9 million in CRF, Coronavirus Relief Fund, funding. And on May 4th, the U.S. Treasury initially they provided us with guidance as to how the money can be utilized, their eligibility criteria, and on May 4th, the Treasury elaborated slightly on how those funds can be used. At this point, we're going through housing and urban development. I'm going to call on Kevin to answer these or make the presentation on the HUD.
Okay. Good morning, legislators. Kevin Crean from the Office of Community Development. The CARES Act included $5 billion which is allowed, in funding to be distributed through the Community Development Block Grant Program and additional funds allocated under the Emergency Solutions Grants Program. These are two grant programs that the Office of Community Development administers annually through its coordination with HUD. But this was an additional $5 billion under a CDBG COVID allocation and an ESG COVID allocation as well. So the funding was distributed in 3 rounds. You'll see on the screen there, we're on screen 9, that Nassau County received funds in rounds 1 and rounds 3. Rounds 2 had funding distributed directly to states and territories. So our total allocation under Community Development Block Grant COVID was about $18 million, and under ESG, about $15 million. So just under $33 million total. Both awards required the Office of Community Development to amend its fiscal year 2019 annual action plan. And we held virtual meetings and had extensive ongoing collaboration with both our consortium member communities and nonprofits, as well as county service agencies, including Department of Social Services, Minority Affairs, Asian American Affairs, Hispanic Affairs, Veteran Services, Senior Services, and others to solicit needs and accept funding applications. The vast majority of the funding was distributed to the consortium members and to nonprofit partners. The amendments were also approved by the legislature on a bipartisan fashion in April and in November. We'll move to slide number 10. Some of the highlights of the funding. I'll go first with the Community Development Block Grant COVID money. Was emergency food distribution, including the distribution of winter clothing in the colder months, residential rent relief program, employment training, mental health and substance abuse counseling. On the economic development side, the Office of Community Development pivoted to include some new programs which we had not administered in the past. These included the PPE distribution to county businesses to assist them in reopening during the early days of the pandemic. We also established a small business loan program in coordination with New York Forward, which is a state program, and also the Restaurant Recovery Grant Program, which was a model for other municipalities, including New York State, which decided to run a similar program after our program was announced. $2.2 million was available for this effort alone. I want to note at this point that both the Boost Nassau Recovery Program, the Small Business Loan Program, and the Restaurant Recovery Grant Program both remain open. So we would like your assistance in trying to get the word out on that, so to let the restaurants and other businesses know that there are still funds available. Information on that can be found at the county's Reopening Nassau website. Moving on to slide 11, you just see the highlights of, the funding grouped into different categories with the amount of funding allocated and the percentage of the total there. Again, this is just CDBG funds. The largest awards were with rental assistance, economic development, emergency food distribution through food banks, and a planning study that's noted there. The planning study is the study of healthcare disparities, and the intent there is to study the causes and the depth of the healthcare disparity in the minority community and to help identify actions the county can take in the future to help close this gap. On the economic development and rental assistance, this was something that was not done before, and our office tried to be nimble and develop programs to address those areas of greatest need. Economic development is something that we expect to continue in the future. This is something that many of our consortium members have expressed an interest for, but rather than fund individual programs in different consortium member communities, we've decided to do this on a county-wide basis so that businesses all over the county can benefit. Again, with future funding, will not be COVID restricted. It will be open to all businesses. So that's something we're looking to continue. Moving on to slide 12, you see the listing of municipalities that receive direct funding allocations of block grant funds under the COVID allocation. We had several other communities identified activities that were funded directly so that they don't show up here. Instead, they show up on the nonprofit list. This included Westbury, who requested funding for 3 local food banks. So we instead decided to contract directly with those food banks. And again, several consortium members expressed the need for economic development in their communities, specifically for those businesses who were hardest hit by the COVID pandemic. This is why the county decided to establish the Restaurant Recovery Grant Program. Moving on to slide 13, you see the nonprofit highlights there. We actually funded, I believe, 27 individual nonprofits, the largest being Community Development Corporation of Long Island, which is running the rental assistance program for us. The distribution of funds under that program began just last week. And under the Restaurant Recovery Program, it's a $2.2 million available for actual grants. $700,000 has been issued already. Next, federally qualified health centers. That funding is for outreach, marketing, and medical care for high-risk, low-income individuals. They were also focusing their efforts on residents of group homes and homeless patients at designated isolation sites. The Nassau Community College funding is for scholarships for low-income individuals and several healthcare-related programs. This will help to address the future needs of the county. The COVID funding has to be used to prevent, prepare for, and respond to the coronavirus. This is one category that will help us prepare for future pandemics should they occur. Next, on to slide 14, is just a list of those agencies that were assisting with the emergency food distribution. There are 16 nonprofits there listed with their individual funding allocations, the largest 2 being Island Harvest and Long Island Cares. Much of this food distribution continues as we speak. There are several other nonprofits that work directly with Island Harvest and Long Island Cares that are not shown here, but that received assistance from those 2 agencies to meet this extreme demand for food. Moving on to slide 15. This is just the highlights of the Boost Nassau program, which includes a couple of other smaller economic development related activities. The largest being, or the most in focus being, the small business loan program, but also the distribution of PPE kits to those businesses that I referenced earlier. So 1,000 businesses received the PPE kits, and it was $400,000 was utilized to purchase those kits. That included hand sanitizer, masks, thermometers, and the like. The Office of Community Development worked with the Nassau County IDA and its local Economic Assistance Corporation to move these funds out. And we also contracted with the National Development Council for both the Boost Nassau Small Business Loan Program and the Restaurant Recovery Grant Program. Okay, of the $250,000 in Community Development Block Grant funds that we contracted with the National Development Council, that helped capitalize a Community Impact Loan Fund, which is managed by NDC, to secure up to $10 million in loan capital for Nassau County businesses. Of that, $1.4 million has already closed as of last week on loans, and 80% of those loans were for businesses owned by minority or women-owned businesses. Moving on to slide 16, it's just a graphic representation of the Restaurant Recovery Program. You see the heat map there for the distribution of restaurants throughout the county. 173 restaurants as of last week have already been approved for funding, and more than $1.3 million has been committed. More than half of the monies have already, more than half of the $1.3 million has been distributed already as of last week. Again, I want to point out that this program remains open. While there are restaurants that are entering the portal every day, we can still use help in getting the word out, so I appreciate your help on that. Moving on to slide 17, we'll switch over to the Emergency Solutions Grant Program. The ESG program is a more focused program. The funds must be used in several distinct categories and also prevent, prepare for, and respond to coronavirus. Again, this is a program that we manage annually, but we have changed some of the use of the funds to address specifically the COVID needs. Over 95% of the funds have already been allocated to 6 program areas. I want to point out the largest one, which is homeless prevention. This program is designed to keep people in housing, renters essentially. The program is designed to pay rent arrears and utility arrears for those who are at risk of becoming homeless. Part of the requirements of the program, is a requirement of HUD, is that those persons demonstrate that they're at risk of being homeless through an eviction notice. And this eviction moratorium that has been in place for multiple months now has meant that no one has been able to qualify for that funding. So while we have $4 million dedicated to that program, we have not been able to utilize any of it as of yet. But we do expect heavy demand once that moratorium is lifted. Moving on to the next slide. There are 17 nonprofit agencies that are working with us, along with DSS, Nassau County DSS, and our own office to help deliver these services. You'll see the different categories of funding there. Homeless shelter operations and services, street outreach for the homeless, homeless prevention, rapid rehousing. Rapid rehousing is designed to assist those persons who have experienced an incidence of homelessness. The intent is to get them back into housing as soon as possible and then deal with their other issues, which could include mental health, loss of job, or substance abuse. Then administration and continuum of care support. The continuum of care support is essentially for HUD reporting purposes, so that is managed by the Long Island Coalition for the Homeless. So that concludes my portion of the presentation, and I'll turn it back over to Paul Broderick.
Just note for the record that Legislator Muscarella and Legislator Schaefer have joined us.
There we go. On slide 19, it discusses the Coronavirus Relief Fund, federal guidance. So U.S. Department of Treasury guidance language, and I quote, "The fund is designed to provide ready funding to address unforeseen financial needs and risks created by the COVID-19 public health emergency. For this reason, as a matter of administrative convenience in light of the emergency nature of this program, a state, territorial, local, or tribal government may presume that payroll costs for public health and public safety employees are payments for services substantially dedicated to mitigating or responding to the COVID-19 public health emergency." And that was issued on May 4th, 2020 from the U.S. Treasury. And then, subsequent to that, on September 9th, the Treasury offered additional guidance, and I quote, "Treasury is supplementing this guidance to clarify that public safety employees would include police officers, sheriffs, deputy sheriffs, firefighters, and emergency medical responders, correctional and detention officers, and those who directly support such employees, such as dispatchers and supervisory personnel." As I mentioned, that was guidance from the U.S. Treasury issued on September 9th. Going to slide 20, this is a breakdown of the $102.9 million of where the county actually spent the money, if you will. The Treasury Department, we had to report our spending to the U.S. Treasury. That started in the first period was for the second quarter of 2020, so that was through March through April through June 30th, 2020. We reported to the U.S. Treasury that we were spending $102.9 million based upon the categories, as you can see. These were categories. They're not financial categories. They're categories as established by the U.S. Treasury. So for consistency purposes, this is what the Treasury requested from all CRF recipients. So we reported we're spending the money in the second quarter of 2020, and then on the right-hand side of that table, you could see the money where we actually spent the money. Once again, the $102.9 million, we spent $102.8 million. We didn't have the ability to spend $81,000 in monies that were allocated to workman's comp expense. We didn't have any expenses there. We ran out of expenses. We claimed what we could. But as you can see, from one period to the next, there weren't material changes in payroll for public health and safety employees. The largest item was down on the bottom, all items not listed above. That was going to be our FEMA contribution. We could have charged that against the CARES Act. But as I had mentioned, Initially, we were saying, okay, here's our CARES funding. We didn't know at the time it was about $16 million in expenses where we were going to submit claims for. 25% was our portion, so we said $4.2 million will go against CARES. But that guidance had changed on January 21st of this year, so the federal government picked it up, thereby freeing $4.2 million for Nassau County. So we reallocated those funds into claims into other areas. And now, you know, the federal government is absorbing 100% of the FEMA expense. Moving on to slide 21. Here are the CRF funds claimed by department. As you can see, based on the guidance that was provided to us, as we previously mentioned, 81% of the expenses were allocated to the police department, primarily towards salaries. And other departments were there as well who did participate in remediating efforts to the county's response to the COVID pandemic. And this over here is just one fund, bear in mind. This is just the CRF fund, as opposed to the HUD funds and then various grants that came into the county as well. At this point, I'm going to ask Inspector Fields to speak to the police department's activities, like as they're substantially dedicated, and he can speak to that.
Just, you don't have to read word for word what's on this slide. I mean, you can just give us, please sum up.
That was my piece.
All right. Please sum up, you know, the activities of the police department, because we are, again, we have time limitations. So, but go ahead, Inspector.
I'll be very, very brief. So just quickly, during the height of the pandemic, the police department responded to approximately 600 pandemic-related medical emergencies. There was about 2,000 police department members, both sworn civilian, police medics, police officers, and supervisors that responded. The first responders, these medical emergencies were different in nature in that they were more strenuous and difficult. A lot of times the first responders had to follow strict universal precautions as well as sanitizing procedures for every assignment. Additionally, other important other units within the police department had to become vital supportive roles in both distributing PPE, coordinating antibody testing, and assisting with some food distribution to those who were in need. And that's just a very brief summary of some of the measures that were taken to fight the pandemic, and in addition to what was mentioned on the slide.
And moving along to slide 23, other departments that to highlight some of their activities with the Fire Commission, distribution of PPE for the 71 fire departments, tracking of all pandemic type calls responded to by fire departments, investigating and enforcing the governor's executive orders for shutdown and enforcement and reopen safely, health department, enhanced disease control, COVID-19 testing oversight, public health information network, enforcement, quarantine, and isolation. Information technology, developing COVID dashboard map applications for the county website, deploying mobile devices and support throughout the county departments for telework. And public works, distributing, PPE, building these protective barriers, disinfecting, which is ongoing, delivering of COVID-19 supplies, hand sanitizer installation, and supporting the various food drives in Nassau County. Moving to slide 24. As I previously mentioned, these were unique funding sources underneath the entire act, and other grants came into the county, allowing us to optimize and leverage whatever the various funding streams that were coming in. A few of the others to mention: Federal Transit Authority, $33 million went to Nice Bus. Department of Justice, $307,000 went for fleet service. Assistance to Firefighters Grant Program. This was for PPE for our volunteer firefighters. Centers for Disease Control, $844,000 went to the Health Department for overtime and public health expenses. Health and Human Services, $478,000 went to police medic overtime. A total of $35.2 million in other funding sources. Looking at slide 25, here's a broad category of where the funds came from, sources and uses. So right now we're looking at, and it's conservative, $26.6 million in FEMA reimbursement. And as I previously mentioned, the vaccination estimate of $3 million is probably on the low side, but we don't know what that's going to be. But once again, FEMA, it's an open incident period, so we can claim if we have the eligible expenses, we can claim for those expenses. Going against the CARES Act grants, you can see the various categories. Primarily, the biggest one would be Coronavirus Relief Fund for the $102 million. And the breakdown of expenses, the largest piece goes to payroll for public health and safety, and safety employees. And then economic support is the next largest tranche of money for $37 million. And that funded a number of various programs throughout the county, not only county, but a lot of our non-for-profits who are assisting Will County residents. And at this point, I'll be turning it over to Andy Persick.
Andy Persick, Office of Management and Budget. I will be brief. I only have 2 slides. On slide 26, it's just showing you what the approved 2021 budget was, which was a no tax increase, no service cuts, no layoff budget. As you are aware, the revenue side of the budget took a pretty bad hit in 2020, and I'll get to that in the next slide, but I just wanted to show you for optics of what the 2021 budget looked like. The preliminary operating results for 2020, we just issued the report, and the county, despite everything that was going on, managed to finish with a $75 million surplus. But again, I want you to focus on, if you look at the revenue side, what the county lost. Of the $3.5 million in revenue, we were down to $3.2 billion, which is a significant hit for funding programs. The timeline, if you remember, with everything that was going on, March hit, then things started to really go into a tailspin, which caused the sales tax to go into a tailspin, which created a big impact on the county's budget. And the guidance with the CARES funding was very dynamic and moving all different directions. So we really didn't know how we were going to be able to spend the money, so it put a little, created a big void in how the county's finances were going to look. As a result of that, we kept moving forward. We identified a transaction with NYFA that was going to save the county hundreds of millions of dollars. And as a result of that, with the bipartisan help of the legislature, we ended up able to approve the declaration of need, which, if you look at the $75 million surplus, 60-some-odd million is related to NYFA and debt service savings, specifically the NYFA transaction, which yielded a $52 million savings in the 2020 operating results. That being considered, if we didn't have the transaction, our numbers would have been significantly low, and they're still unaudited, which means that they might, by the time the controller and the outside auditors get done, might move slightly. It was a very unique year financially for the county, as with every municipality. And I will say there was some trying times, but we were able to meet all the needs that we had to deliver services, to deliver PPE equipment to help residents, whatever we needed. It was never a no, it was what we could do, but it was a lot of juggling of the deck, I will say. To be where we're at right now, I think, is not a bad thing, and I think it's everybody's goal, I think, in this administration, including this body, that we exit the control period with NIFR as soon as possible and give it back to the elected officials to handle. So, and the gateway to that is continue to finish on the plus side when we're doing budgets. It's a good practice to finish with a surplus. A deficit is not something I want to be coming to you with, but I want to make sure that, you know, everybody understands that in order to get out of the control period, it was a little painful to get there, a little lucky, but I think we're on the glide slope in the near future to exit it at some point. So I'll be here to answer any other questions you may have, and I'll be short and brief, and that's all I got for you.
Okay. Well, thank you for the presentation. Inspector Field, I apologize for cutting you off a little bit, but I appreciate you summing up. And obviously, we had the information that was there.
I totally understand.
I'd like to know for the record also that Legislator Bino had joined us in the process of the presentation. First thing I would like to say is, and this raised it in my mind, part of the presentation is the absolutely heroic effort on the part of many of our county employees, the police department, fire marshals, health department, DPW you mentioned, but across the spectrum, of course. They were absolutely heroic in terms of their efforts during this pandemic, and I want to express our gratitude to them as well. And we also appreciated your reference to the HUD funds that were received and the various programs that were developed as a result of that. I think the issue that we're having is that there were other opportunities for increasing and enhancing those programs. And I specifically wanted to focus on the coronavirus relief funding, approximately $103 million. Now, you included guidance with respect to expenditure of those funds with respect to payroll. Was there, I'm assuming there was other guidance, there were other purposes that you could have spent coronavirus relief funds for, correct? Or was it limited to reimbursing of payroll?
Well, you had substantially dedicated individuals. That was part of the guidance that we followed. If the individuals were performing more than 50% of their workday reacting to some aspect of COVID, then it was an eligible expense, yes.
Right. I think I was just acknowledging that that is an eligible expense for this coronavirus relief fund, but there are other purposes that money could have been spent for, correct? It was not limited to reimbursement of payroll, or?
Yes, sir.
Okay. And if you could just tell us of the approximately $103 million in those funds, how much went to backfill payroll?
For the salaries?
Yes.
66.7 million.
That was the total number that was spent for salaries?
That was salaries. Then fringes was 31, so about $98 million.
So all but $5 million of that went to salaries, correct? Of the coronavirus relief funds, correct?
Yes, sir.
And while all of that money was going to salaries that were budgeted, we are winding up with a $70 million surplus at this point.
Well, I think we have to take into consideration the other $33 million that came into HUD.
We acknowledge that those monies came in through HUD, and they were for programs, and we, I think Kevin did a fantastic job. HUD did a fantastic, the Office of Housing and Urban Development of the county, I didn't say that correctly, but all of the county staff did an outstanding job in making sure that money got distributed, and the leadership in those departments as well. But I think we're focusing now on the coronavirus relief fund. Again, the point is, after spending substantially all of the coronavirus relief fund for salaries, the county ended up 2020 with approximately a $75 million surplus. Is that correct? Andy, you were shaking your head? Right.
It is on.
Why wasn't some of that money spent for programs instead of for salaries?
Well, I guess maybe I should have said this in the past. We don't know we have 75 yet, so let me just, because when you close the year out, you don't know exactly what the number is going to be. So for me to tell anybody that you can spend $75 million, it would be a dangerous part for me to disclose that, because we didn't know. We don't get our final sales tax checks in until the subsequent year, and I can't move money to appropriate. So the best thing we could do is finish on the plus side of it and then have this money at a disposal for future use, because we don't know what we don't know, and where the, I would say, the economy was trending, we didn't know. And plus the guidance with the coronavirus relief fund was so dynamic, we didn't know how we were going to spend it at first. Then we figured out how we could spend it, and it offered budgetary relief. But I'll not to reiterate, but that the $60 million in debt service savings, which kind of materialized at the end of the year because the transaction occurred in November or December, there was still a lot of moving parts at that point. So I don't think we could have spent that surplus, even if I was confident in it, just based on the timing of how things occurred, because everything was moving. You know, hopefully the recovery and what's going to come is going to be better than where we're at, but we have a base for now going forward to spend what the constituents may need, what the county executive and this body sees fit to going forward to provide stabilization, not only to the county's finances, because we're still, I hate to say it, in a control period, but it gets us to a point that puts us on better fiscal ground if this thing bumps around a little bit more, which I don't have a crystal ball. I don't think anybody does. So sorry for the long-winded answer.
Well, I would disagree with you in terms of how the economy was faring throughout the second half of 2020. We've had this discussion multiple times in which you insisted that the county was going to finish with a negative 20% in sales tax revenues, and we, based on what was happening in the actual economy, the actual sales tax receipts, the actual projections of other offices, including the Comptroller of the State of New York, told you repeatedly that that number was unrealistic. So, I mean, to say, well, we didn't really know, truth of the matter is, if you didn't know as a budget person, you should have known, because it was obvious that the sales taxes were substantially ahead. And let me get to a more pointed. In December 23rd, the administration came to us on an emergency basis 2 days before Christmas and said, you have to approve this $20 million, I'm not sure the correct term, but the $20 million so that it can be released to pay payroll. And at that point, on December 23rd, after a full year of what was developing, you chose to use CARES Act funds for payroll, whereas it was obvious at that point sales taxes were coming substantially ahead of so the point I'm making is that money could have been spent for a variety of purposes. It didn't have to be spent for payroll, to build a budget surplus for this administration. It could have gone to pay for more money for restaurants, more rent relief, more PPE, more food distributions. So at that point, you did not know that the county was on its way to having a substantial surplus in December of 2020.
I couldn't confidently say that we were going to have a $75 million surplus, because if you looked, we've had that discussion on sales tax, some of our other revenues were down significantly too, specifically departmental revenue and state aid. Our TIFA revenues went south on us because the number of people driving just disappeared. So that clearly was a significant factor in the decline. The revenue side of the equation was always the problem with this budget, we didn't know where we were going to land. And I couldn't hear. It's better for me to finish with the surplus than without a surplus, presiding officer, but I think 75 was specifically related to one transaction. It would have been 15 if that didn't occur. So, as I said, it's while we probably could have dispersed, I don't know how we could have dispersed more than what we did, because we were getting all these funding sources, and procurement and everything else, timing to get things out to the public probably would have taken significantly longer. I don't think we could have committed anything because at that point we didn't know where the county's finances were going to be, but we would have finished with a thin margin. You know, if it would have been negative, the conversation's different then. You know what I mean? And we didn't have all these funding sources that could help the operating budget because we had to keep people in chairs and we didn't want to cut services. So, you know, the state, till recently, was 15-20% reduction, which is $200 million of what we expect in aid from the state. There was some federal money that came in to keep the buses going, but again, going forward, the landscape of, I think, the economy probably will change. I'm hoping for the better, but there's going to be pieces of it. You know, ridership's down on the buses. You know, how many restaurants of vacancies we have in commercial property right now. I mean, that's a stat that, you know, is very interesting because that kind of tells you what the current future is going to hold. And then when the vacancies start evaporating and moving up, then you know that the economic recovery is coming that way. Unemployment is still high. I mean, there's still not a lot of claims, even though you're reading numbers. So I think there's still a lot of need out there. And I think the pathway of having a surplus kind of gives us the ability to take that money and spend it forward. So, you know, and I don't think, based on the numbers that I saw, that, you know, we did everything humanly possible that we could to get money out to the people. I can tell you when I first started on those SIP rep calls that PPE was the hottest topic that we could. It was unbelievable why you couldn't get it. And what you were paying for all the stuff was ridiculous. And now we're heading into what I would call, you know, an inflationary period, which means that, you know, the cost of commodities and everything else are going to increase dramatically. And, you know, where healthcare costs land and, you know, what's going to happen, I don't know. This is going to get expensive somewhere in the future. And I think the basis that, you know, we built here between the administration and the legislature is the county's on better fiscal footing than some of our neighboring partners. And that's, you know, I can't say it any differently than that, but that's kind of, we're in a better place than where we could have been. So.
And you're consistent anyway, in any event, because you're continuing to refer to all the uncertainties that are out there. In December, we specifically told you that what you were doing, the administration was doing, was building a surplus to pat yourselves on the back to show you what a great job you did, instead of providing those money in programs to people who need it in our economy. But you said that surpluses are used to spend it forward. What did the county do with its 2009-19 surplus? My understanding is approximately $116 million. This is 2019.
Correct. The 2019 surplus we were going to use in case we had a deficit on the other side of it. The plan was always a plug. We had that money out there. We have not spent that money yet.
So then, if you're saying the surplus is to spend it forward, why didn't the county spend its 2019 surplus in the middle of a pandemic?
We used it as a placeholder in 2020 to see if there was any additional revenue shortfalls. And the only way I could spend it forward would mean that when I did the budget in September, I would have had to take the money that was in fund balance and spend it forward. But I already anticipated possibly using that in 2020 to cover the shortages of revenue. So it would have had to been done as simultaneous act with the budget, you know. And you have to keep in mind, not that this is a factor in where you're going with this, but remember, that gets used against me in the NYFA gap, which is, you know, another component of it because it's a single revenue source. But I would have had to appropriate it, and I'd already thought that I was going to spend it at that point when I did the budget. So I can't spend it, but going forward, we have the ability to maybe pay down a future expense, put it into a reserve, take down some of the debt that we just issued. There's a whole myriad of things. I don't think we've landed yet because I know I keep using uncertainty, but there's a lot of things that pop up. So that's what I think. Going forward, we have a place to spend this money and relieve the operating budget to pay other things with those surpluses.
It was identified as a gap closing measure all year, correct?
Yes, it was. That's correct.
$116 million. And again, the administration chose to use the CARES Act funds to pay salaries. It had a $116 million surplus sitting in unrestricted fund. Could have been used to pay those salary shortfalls frees up the money that goes into the community, number one. Number two, it was obvious sales tax receipts were well ahead of your projections. It was obvious, because we said it from this dais, that you were going to finish with a surplus. Administration chose to finish with a surplus in 2020 instead of putting monies into the community. I understand that you can pat yourself on your back all day, but people were suffering in 2020, and those monies, which were available, should have been paid to assist those residents who were struggling, the restaurants who were struggling, and I just think it's inexcusable. Anyone else? Legislator Ferretti.
Thank you, Presiding Officer. Good afternoon, gentlemen. Mr. Broderick, thank you for your presentation. I did see the outline here in terms of money spent for testing, contact tracing. Now, out of the CARES Act, that's a total of $3.8 million, correct?
Which slide are you referring to?
Slide 25. Well, that's from FEMA, 3.75, and then 81,000 roughly from CARES money, totaling about 3.84.
Okay, we're a FEMA category? I'm sorry. FEMA?
No, so I'm talking about the COVID-19 testing and contact tracing.
Yes, sir.
Okay, so around 3.84 million. Is that the totality of money the county spent on COVID-19 testing and contact tracing?
I would say that's an estimate because the 3.7 million might not be all the additional expenses coming in. But, yeah.
Approximately?
Yeah.
Okay, and does that include PPE, or is there another, I see that, I'm sorry, that's another line down at the bottom. That's another 3.5 million roughly, right?
Correct.
And is that the totality of money spent on PPE by the county, approximately?
Approximately.
So if you add those up, basically you're a little bit over $7 million for PPE, testing, and contact tracing.
Correct.
Now, can you tell me what's the purpose of distributing PPE and doing the testing? Is it preventative?
Well, the PPE, as I believe Andy had just mentioned, there were supply chain issues initially on, and I think everyone experienced that in one way, shape, or form, where their supply chains broke down, and everyone was bidding up the cost for masks. So,
well, let me just stop it. I'm not talking about cost. Forget cost.
Okay. Distribution?
Why are we distributing PPE? Why are we testing people? Why were we?
We were testing people to identify individuals who had COVID to quarantine them.
And what's the point of quarantine?
Well, I think maybe Dr. Eisenstein, if he's on, he could probably answer this better. I'm not a healthcare expert, to be honest with you.
Good morning.
Good morning, Dr. Eisenstein. I don't know if you heard the question, but basically what I'm not trying to trick anybody. It's basically a pretty straightforward question. We spent over $7 million of money handing out PPE, testing, contact tracing. Would you agree that was to try to stop the spread of the virus and save lives?
Yes, of course.
Of course, right? Okay.
Yes.
Thank you. Now, Mr. Persic, the CARES funding that was allocated to Nassau County, we could have used that money for COVID testing, for PPE, for contact tracing, right?
You're asking a legislator. I can't say that definitively. I would say that some of it could have been used, and I think some of it was used for that.
Well, wait a second. I'm asking if it could be. It seems like we did. So I would hope that we can, right?
Correct.
So we could do that, right? We could have used more, right?
I don't remember what the guidance was for that. I'm going to defer to Paul on that. But there was the preliminary structure when it was set up was it could be used for certain things, and then the guidance changed for public safety. But I think.
Well, hold on, Mr. Persic. Yeah. It's a pretty straightforward question. Could the CARES Act money be used for COVID-19 testing? Yes or no? You don't know?
The answer is yes. I'll just. Yeah.
Okay. How about PPE?
Correct.
And how about contact tracing?
Yes.
All right. Now, how many sites did the county set up for COVID-19 testing?
I believe Dr. Eisenstein would know that better than myself.
So there were a lot of sites. Some were run by the state, some were run by us. We contracted when we saw a need in the 5 towns. We contracted with South Nassau. That was the first community that really we saw an uptick in. South Nassau set up a testing site that we paid for at the Five Towns Community Center and Goral JCC. We contracted with Northwell for a testing site on the North Shore, and we contracted with the federally qualified health centers in the areas which were hardest hit by COVID, and those are our sites that provide our primary safety net. So those were the sites that we set up. Jones Beach was up and is still up the entire time as a state site, and there were other state testing initiatives around.
So, Dr. Eisenstein, I remember back to about 2 months ago, really right after the holidays, standing myself on a very, very long line with two impatient children to get tested. So you would agree that there was a significant amount of time in Nassau County where to get tested you had to wait hours and hours and hours to get a test?
Well, it depended on the test. For the people that wanted a rapid test, there were lines, yes, but every single day there was capacity at Jones Beach. So it depended what you were looking for. But yes, there were certainly lines. I saw them as well at some of the urgent care centers.
Right. And now I know you just listed a bunch of the sites, but some of those sites that you were naming were not county sites, right? Jones Beach isn't a county site. And
correct.
Right. So how many county sites, county-run sites, at the peak of testing were there?
The sites that I mentioned before, the 5 FQHCs, as well as South Nassau's site, which relocated to their hospital grounds, and Northwell. But what happened is in November and December, as vaccine became available, their capacity to provide testing decreased. And so, for example, the Northwell site didn't end because we didn't have a demand. The medical community had to shift its resources to starting to vaccinate. We used as many sites as there was capacity in the healthcare system to do. We didn't have more capacity in our healthcare system to increase sites at the time. And you see how successful the vaccination has been in the county. We're the leader in the state, and that's because resources that had been used for testing had to shift. So we're at our capacity.
Well, I understand when the vaccine became available, you have to shift resources. That makes total sense. But there was a period of time where the vaccine was not available. People were looking to get tested and couldn't, or well, they could, but for practical purposes could not. And so it's somewhat alarming that we had all these extra funds of CARES Act money, which, quite frankly, really were intended for things like testing, PPE, et cetera, which we know is intended to save people's lives. But instead, we've apparently decided to have a $75 million left over, a surplus at the end of the year. That's wonderful. I mean, that makes for great headlines in an election year, but it doesn't save lives. Doesn't save lives. That money could have been used for more PPE, could have been used for more testing when people couldn't get tested, and I know for a fact that that was the case. I know for a fact that there was never a testing site set up in my district. There were people that, granted they can go to CityMD and wait 4 hours in the freezing cold, in the rain, in the snow, but people don't do that. They say, forget it, and they don't get tested. Some of them probably had COVID, some of them probably spread it. And meanwhile, we're sitting on this stockpile of money, as we all knew and said and predicted, and now we see the results. The results are that there's a great headline out there for an election year. Wonderful. But, Mr. Persick, I disagree with your interpretation that, a surplus is a wonderful thing. Not when people are dying. Not when people are dying and we could have used that money. Not when businesses are dying and we could have used that money. Yeah, in a regular year, having a surplus and spending less than you take in, wonderful. This isn't a normal year. This is life and death. And it's really sad that we were, quite frankly, misled. Not 6 months ago, not 8 months ago when these were projections. Like 70 days ago, you were sitting here and telling us we had an emergency and had to transfer $20 million. We now know we didn't. That wasn't true. We did not have an emergency. We did not have to do that. Just lastly, and this is, it's really not COVID related, but you did have it in your presentation, Mr. Persick, so I want to address it. The administration continuously says, and they put it in writing today on page 26, 2021, no property tax increase budget. Isn't it true that the budget was increased, the tax levy was increased over $9 million in 2021 with the sewer tax and the general fund? Isn't that true?
The five major operating funds did not contain a property tax increase. The sewer district did have an increase in it for services to provide for the sewer district,
Okay,
which
so
is
how
not.
do you pay for sewer tax? How do you pay for that? Is it through your property taxes?
It's through your it's through your property taxes.
Okay,
that's
so
correct.
when you say that there's no property tax increase, that's not exactly true.
In the five major operating funds, that is true.
All right. Well, you know what? To people right now struggling with the pandemic, people whose businesses closed down, they're going to read we have a $75 million surplus we've got to help them with, and there's a no property tax increase budget, which isn't true. Let's be honest to the residents. Let's be honest to this board. You haven't been for the last 6 months. Let's start now. Thank you.
Okay, we have a number of legislators who've asked to speak next. Legislator Ford, Schaefer, and Rhodes. In that order.
Good afternoon. Thank you for your presentation. I'm probably going to be bouncing all over the place. But just on the salaries, you know, you highlighted the fact that the, I guess the official guidance language would go to basically police officers, sheriffs, deputy, whatever, fire, whatever. But yet, when I look at the money that you claimed for each department, some of them are not related to firefighters and the police. Why? Am I just reading something wrong here? Yeah.
There we go. How's that, better? There we go. The guidance, they said substantially dedicated. And we asked a number of questions of the U.S. Treasury, county attorney, and as well as the comptroller. Substantially dedicated is saying someone in any county department that's providing services, if you were substantially dedicated, meaning for either the first couple of months of the pandemic, basically we were saying from the inception through May 27th, if you were working more than 50% of your day on COVID-related activities, it could be direct response, such as the police department, it could be in the correctional center, you know, isolating inmates that just come in to maintain social distancing and not to transmit the disease. It could be people in constituent affairs answering people's questions when residents call. It could be a number of other individuals indirectly associated with addressing the pandemic. DPW, it could have been, I don't know, you know, electricians, you know, it could have been people erecting the plexiglass.
I get that, but will you be able to give us that guidance that it's written?
Absolutely.
Because it clearly states that it's for service substantially dedicated, but it's for the public health and public safety employees. So this is where I'm a little confused. And I look at, and I agree with my fellow legislators that, you know, when we look at the money that we spent, and it's fine that we covered a lot of it with payroll, which we're allowed to do. I'm not arguing. I would question the amount of money that we allocated toward payroll when we already funded a lot of these positions in our budget. But, you know, for me, it's, you know, when I think about the people that suffered during this pandemic, that it seems that we covered ourselves, you know, sometimes at the expense of other people. You know, so, because I would like to know then, in regard to all of the money that we can allocate and how we could have helped people. I know that with the restaurant recovery, which is very important, unfortunately, we've had a number of restaurants that have closed. So I think we, you know, I wish that we could have been, you know, I wish more of them were able to get the money that they needed to help them through, you know, the winter and through all of that. But, you know, that's just part of, I guess, the whole problem with the pandemic and stuff like that. But some of the costs that, you know, and I'm asking this generally, when we look at the cost of what we can do to help people during the pandemic, and I know that we did a great outreach, I guess, you know, into Dr. Eisenstein and getting people tested. I know that when Legislative Reddy talked about those who stood in line for hours and I saw it in Long Beach. I couldn't believe it was snowing out, and people like had a line, you know, probably about 2 to 3 hours. They were waiting outside. You know, for those people, though, a lot of that was the rapid testing. And I would like to know how, you know, with the PCR, which is the one that, because a lot of agencies, especially those of the people, the residents, our residents, who worked for New York City agencies, they did not recognize rapid tests to allow people to come back to work. They required that a person get a PCR test. Otherwise, then they wouldn't allow them. So if you were a police officer and you had coronavirus, you couldn't go get a rapid test. Or if you thought you had it and you couldn't go to work, you couldn't go and stand online for 2 hours to CityMD because it would be a rapid test, and that was not recognized, okay? You know, as a standard test. Firefighters had to get a PCR test. So, you know, I'm curious as to, like, even how many, I know that we funded a lot, but we should have had, I guess, maybe more sites to test PCR. And I know that it was a blessing to go to Jones Beach, but, you know, for me, I have a lot of people who couldn't make it to Jones Beach because they don't have cars, and there was no public transportation. And as well as Nassau Community College or other sites, there was no direct, that people would have to get on, a lot of my residents would have had to get on buses and take 2 buses because there was no direct route to any of these testing sites. But, so then my question would be that could we have used some of this CARES Act? You know, because we have the nice buses and we have the variable bus ride. Would we have been able to expand transportation and then maybe offer to people who were seniors or who had the inability to be able to travel to be tested or even to be vaccinated? Did we have the ability to maybe provide an expand Able Ride or even an Nassau bus service to be able to provide transportation, to have pickups and bring people so that they can get either whether or not to get the PCR test or to get vaccinated?
Legislator, I understand your questions and concerns. I believe
But I want an answer.
Logistically, I don't think that this is an easy question, and this is outside my area of expertise. I would, you know, defer to Dr. Eisenstein yet again, because I don't think it's as a straightforward answer, given the complexities and the logistic coordination between Nassau County, the state government, and the federal government on testing and how they were coordinating those activities.
And I recognize the efforts on part of Dr. Eisenstein, and you know, he's had a full plate for ever since about a year now, probably even more before this, you know, more than a year. But where is the responsibility? We as a county, you know, we have so many departments that could have all gotten together to say, well, how do we best approach this? How do we then deliver better? It's nice, you know, we did PPE, we gave people equipment, but, you know, for me, I have, and it is a sore point with me. I'll tell you right now, it's the seniors, okay? You know, my aunt is going to be 100 this week. She's finally getting her 2nd dose. I mean, when I look at all of her friends, okay, that are in their 80s, 85, and 90, okay, that still, some of them still have not gotten their 1st dose, okay? So when I think of people who are at home, that are stuck at home, that they really don't have the ability to be able to get out, and we as a county, we had all of this CARES funding, and, you know, really, did we ever think about maybe providing some sort of access? We never even originally, and I know, and I applaud Dr. Eisenstein, so I'm not even, you know, he's a saint in my eyes, but when I think about the rest of us, you know, with whether or not we could have registered our seniors way back when, so that instead of every single day, but when I think about the money that we spent on salaries, you know, which we already funded, I think we fell short on maybe providing other services that went above and beyond what we normally do, to like really say to the residents, we really and truly care about all of you, and this is what we're going to do to make all of this easier for each and every single one of you. My last question, though, then would be also in regard to with our interaction with schools. Were we permitted to provide any type of funding to any type of school activity?
Like, what kind of activity are you referring
to? Well, I mean, you
to?
know, to help the students. I know under mental health, perhaps we would provide counseling services.
I honestly don't know. I honestly don't know.
Did we explore this? Did we look out? I mean, you know, for me, I think about like the children who are, you know, I know that we do provide service. We, you know, early intervention, whatever. We have mental health experts. You know, considering the fact that there would have been an increase, we believe that there was an increase in opioid use and, you know, that type of behavior, whether or not with drugs, with alcohol, a certain amount of abuse that went on. How much did we honestly spend on all of that to do outreach, to try to reach out to people that we knew had these issues?
Well, I think, let me just, part of the answer over here, I believe, is that those, like Health and Human Services, they continue to provide services to people who need assistance. And unfortunately, with schools shut down and, basically things were shut down for several months last year, a lot of things were probably underreported. But the county was providing services for individuals getting, who reached out, or we reached out to them. As for, your concerns of discussing the senior population, people with limited English, that's a challenge to reach out to that community. Transportation could be an issue. But I do know that various efforts were taken to go out and to address those communities and make them aware of various testing or vaccinations. And I guess the guidance coming from the state, somewhat vacillated between 1A, 1B, 1C. Who's in
Aside
what?
from that, I'm not talking about the vaccination.
Okay.
I'm talking about is the outreach. How much of the CARES funding went for that type of outreach? And I think would that fall under you, Kevin, or?
Some of that would be legislative. Some of that would be in departmental expenses. If staff members were dedicating their time to providing COVID outreach, that would be a salary expense that we would charge against the CRF funds. And just back to your concern or comments regarding testing, that we didn't spend much money, much CARES money. CARES money is limited money, as I explained earlier, so $102.9 million. FEMA is basically unlimited for those activities. So we can, as long as we were providing the service, we could claim the expense. And to some of the other questions you had, maybe Dr. Risensee could explain, I don't know, the operational logistics of what occurred and how that occurred, because I don't think it's, at least from my understanding, I mean, it just seemed like there's a lot of moving parts, which not only, I don't think the county can unilaterally just do what they want to do, but they have to do it in concert with coordinated efforts from New York State Department of Health, New York State Department of Homeland Security, FEMA, and CDC, I guess.
Well, my final thing, because I know there are other legislators. So then my question to you then would be that you worked with the Department of Treasury to find out who you could pay under the payroll allocation.
That's correct.
Even though it clearly states here that you provided us that would be public safety, whether or not it's police, firefighters, and so forth, but then you have a whole list of other people. So, my question then would be, I'd like to see the discussion you had with the Department of Treasury about the possibility of expanding what you could spend the CARES Act money on other than payroll. Were there others? Did you ever ask about transportation? What would you do about the residents that are homebound? What about this person? What about that? What about our school children? How do we handle this? I'd like to see the notes of that conversation. Because if you made sure that you were going to get the payroll taken care of, what about the rest of the people that are not on our payroll? And I'll end with that thing.
Legislator Schaefer, Rhodes, and Walker.
Good morning.
Good morning.
I'm going to focus on the restaurant recovery program, so I don't know who I should direct my questions to. Okay. Okay. Can you tell me, do you know approximately how many restaurants there are in Nassau County?
I believe when we were putting together that program, we did do a survey. Off the top of my head, I cannot recall, but there was roughly around 500, I believe, of sit-down restaurants. That was part of the discussion, was what qualifies as a restaurant. Does a deli that has takeout or a restaurant that has solely takeout, does that qualify as a restaurant? We opted to exclude them from the restaurant recovery program because they were less impacted by the coronavirus. They were not impacted by the seating capacity mandates of the state government.
Okay. So you think approximately 500 total in Nassau County?
I can get that number for you, but, yeah.
It's okay, yeah, an approximate is good. Okay, and the total amount that was allotted to this program was 2.5 million, or was it a different?
It was 2.5 million, roughly 2.2, 10% of that was for the administrative costs of the National Development Council. So roughly 2.25 million was available for actual grants.
2.2, okay, what was the other thing you said? I'm sorry.
The National Development Council is administering that program, so the rest of that was for their fees for review, for outreach, or to purchase the software to run the program.
Fees for review? Are they in-house, the Economic Development?
No, that's the National Development Council, is a nationally based nonprofit organization. They have run similar programs in other areas. We patterned ours after one that was being handled in Texas, actually.
Okay. Who determined how much money would go towards this program?
It was our office, essentially, looking at the budget and how much funding we had left and the demand, other requests for funding that we had.
Okay. And where did the funding come from? It came from HUD, right? It wasn't from the CARES Act?
The Community Development Block Grant Funds, the COVID portion, is actually a portion of the CARES funding, but it's not related to the CLF funding that Paul has been speaking about. Our funding was specifically a HUD allocation based on a formula that HUD utilizes. But technically, it's CARES Act money, but it's Community Development Block Grant COVID portion.
Okay. Was that the only place it could come from? I mean, I'm just trying to understand exactly.
There was not a competitive allocation of Community Development Block Grant COVID money. It was done based solely on a formula. As I mentioned in my presentation, there were 3 funding rounds. The first round was based on the county's general formula, how we receive our allocation every year. It factors in population, poverty rate, age of housing stock, and a couple of other factors. So that was utilized for the first distribution. The second distribution, the second round, was what is specifically to states and territories. And then the third round was the HUD secretary determined how that funding was allocated. So they looked at other funding factors. I think they also looked at the COVID rate in different communities to determine that amount of funding. But it was not competitive. We were not able to apply for additional funds, if that's what you're asking.
Okay. Do you know how many applications you received for the Recovery Grant Program?
Well, we reached out to, when we received the award announcement for the first round, we were in the midst of our 5-year consolidated planning process. So we were already meeting with our consortium members, with nonprofits, with different county agencies. So we piggybacked onto that outreach. So I can't say for certain how many applications we received, but it was over 100 applications. And some of them came from consortium members that had multiple applications, but we consider that as one. Many of the information we were getting at the time, we were hopeful that the funding could be utilized similar to the past Recovery Act funds, disaster recovery funding that could be used to stimulate the economy. Mm-hmm. So we were hopeful we were going to be able to put some of that money into what I consider our regular block grant type activities, downtown revitalization efforts, street and sidewalk improvements, that like. So we received a lot of applications for that. Unfortunately, the guidance we received from HUD said that was not eligible. It was not sufficiently related to COVID to qualify. It was not a jobs program. It was not trying to get people back to work. It was trying to address the pandemic issues. Right. So we received over 100 applications, I would say. Many of them were determined to be ineligible because of that reason.
Okay. How many grants were allotted? Because I think the website says 171.
Well, that's specifically the Restaurant Recovery Program.
Right, that's what I'm talking about.
Oh, I thought you were talking about broadly.
No, just Restaurant Recovery.
I think we're over 200 applications at this point. There were several, I think there were about 100 applications. So it was probably over 300. About 100 applications were incomplete. NDC has been going back to those restaurants to determine why they didn't complete their application. Some of them have completed them. Their understanding is, their analysis, because the way the intake system works is you can't see the application until you register. So you have to register, and that counts as an application, unfortunately. So there may be a lot of restaurants who've gone into the system just to see what the application looks like and realize they're not eligible. Obviously, the restaurant has to be located in Nassau County. Mm-hmm. It has to be a sit-down restaurant. It cannot be part of a franchise. So there are some restrictions. So some restaurants may have just eliminated themselves and decided not to pursue the restaurant, the grant. But I believe the applications are over 300 at this point.
Over 300, okay. And you've already allotted, though, you said like 2.2 million? Or
No,
that's how
2.2
much
is
you
the
have?
total.
Is
About,
the
I think
total?
1.4 has been allotted already.
Okay, 1.4. Has been distributed, is that correct?
No, about half of that's been distributed. The rest, some of that will go out this week. It's continuing.
Okay, okay. 1.4, let's say, is committed to that. So
Correct.
you still have some to go, which is why I guess you're saying earlier, you still have more money available for us to help you get the word out.
Right. The application portal was closed after a couple of weeks of being open because of the demand for it. The grants are two different sizes. So a restaurant with more than 25 employees can apply for $10,000. Those with less can apply for $5,000. So until they review all the applications, see what's eligible, it's hard to determine the amount of funding needed. So to eliminate restaurants applying and then running out of money, we closed the portal, but it has been reopened for a couple of weeks now to accept additional applications.
What's like the average amount of the grants you've distributed? Could you give me an average amount? And I guess I'm looking also for, what's the largest amount and what's the smallest amount you can
Well, it's
distribute?
either 5,000 or 10,000. That's just a
okay.
threshold.
That's it, okay.
Those that I've seen come in, because we are, getting reimbursed from HUD as the funds go out, I think they are probably more heavily on the 5,000 side. So they are more smaller restaurants than they are larger.
Okay, I know something was mentioned earlier about the process of distributing funds, potentially, and that it takes a while. Was that an issue here, that it took some time to get those grants to the restaurants, or no? Maybe we were talking about something else previously.
It was slower than we anticipated. We were hoping to get the grants out in mid-January. It ended up being about a month later, but they started flowing in early February. So we were a couple of weeks behind. But no, I don't think that was an issue. The contract routing process does take some time, obviously, but our second amendment to our HUD plan, which is where we took these funds from, was only approved by HUD in December. I think I came to the legislature with that in November. HUD was very quick with turning the amendments around, particularly because the projects we were funding were clearly eligible under the program. So it wasn't a HUD issue. Once we received approval of the action plan, we started writing that contract pretty quickly. And we wanted to get the funds out around Thanksgiving time. That's when the application was announced. It was actually open for applicants the week after Thanksgiving. And so it's been about 2 months in review process. The Department of Health is involved because the restaurant does have to clarify that it's received a positive Department of Health review. So that's part of it too. So there's a little bit of delay there.
Can you tell me from the time you received an application, if you can tell me approximately how long it took to review it, and then to the point where you actually were able to send the grant money out?
Well, again, that's not being done by our office. That's being done by National Development Council.
Okay.
But the first applications were received, I want to say early December. So probably about 2 months, 6 to 8 weeks before the funding went out initially.
Was there any way that we could have made that a shorter timeline? Is there any way we could have hastened that process? Because
That's hard to say. Our office reached out specifically to the Comptroller's office, and part of the contract language that we have with NDC is to allow a $500,000 advance payment so that they could capitalize the funds and have funds available to distribute. The Comptroller's office was very helpful with that, so the contract did include that language. The $500,000 was advanced. So it's hard to say where any breakdown was, if there's any one specific item. I think we had a lot of restaurants that were slow in completing their applications, but the process is that they complete the application, NDC reviews it, they determine if the restaurant is eligible, then they forward the information to the Department of Health. The Department of Health does their review, sends it back to NDC. A grant agreement is issued, and then it has to be returned. There does seem to be some delay there, because the grant agreement rather, return from the restaurants has been a little slow, because they also have to provide information on their wiring instructions from their banks. So there is some delay there. It's just a bureaucratic process, I think. But I don't think there's any one time period where there's a significant delay. It's just a few days or a week at each phase of the process.
We're getting a little short on time, so Legislator Schaefer, if you could just sum up,
Okay.
and like several legislators are waiting.
Sure. Is there any opportunity to get more funding for the restaurant recovery program at this point in time, especially considering we have the surplus that we have?
I'd have to defer to Paul and whether that's an eligible use for that funding, but if it's available, I'm sure we could just add some funding to the
Yeah, I mean, my
NDC's
thought is-
contract, right? If
right,
it's an eligible
also,
use, right.
Is there funding that we have now, again, looking at a surplus and realizing that, restaurants and other businesses are going to hear that, and it's probably not going to go over too well when they're maybe closing their doors, or they don't have employees that they can hire back now because they're gone. So I'm wondering if there is any thought about that. Is there a way to help businesses more that we're considering, even if it's just out of the county funding?
Legislator, I will say this, why some of the money is funneled through the housing areas, because the means that they have the ability to get the money out. I don't know the legal requirements, how we distribute funds back out to taxpayers, selected taxpayers, so that becomes a challenge here, because I want to give Paul money, I want to give Phil money, I want to give you money, but I don't want to give Legislator Drucker money. I don't know legally how we could distribute those funds and how that would work, but clearly exploration is going to happen because of, just how we're going to help the businesses. But there is some legal problems that we do have giving money back to residents selectively, so.
Okay. Okay, I think that's all I have. Thank you.
Legislator Rhodes, Walker, and Drucker.
Thank you, Mr. Presiding Officer. I do find it fascinating that probably about 75% of the presentation that you gave at a CARES Act hearing was with respect to the county's use of other funds providing direct assistance to residents as opposed to CARES Act funding. So I want to focus on CARES Act funding specifically. Now, the purpose of the CARES Act, is anybody aware of what the stated purpose of the CARES Act was? According to the federal government, was to provide fast and direct economic assistance for American workers, families, and small businesses, and to preserve jobs for American industries. Right? So let's talk about how much money Nassau County spent of its CARES Act funding, $103 million that you received from the federal government to provide fast and direct economic assistance for American workers, families, and small businesses, and to preserve jobs for American industries. Am I correct in my understanding that Nassau County spent $98 million, or roughly 95% of the CARES Act funding that we received on salaries and fringe benefits instead of providing fast and direct economic assistance for American workers, families, and small businesses and to preserve jobs?
Legislator?
That's a yes or no question. Am I right in that understanding?
No, you're incorrect.
Why is that?
Because that's not eligibility criteria. That's an overall theme. They want to assist. But the criteria as to how you can spend the money, if you just repeat what you said, how do you define any of that?
So are you telling me that, for example, we could not have spent CARES Act funding on rental assistance?
Possibly.
We couldn't have spent it on economic development. We couldn't have spent it on food banks. We couldn't have spent it on public facilities improvements. We couldn't have spent that money...
Public facility improvements for capital improvements?
You couldn't have spent that money on assisting schools and providing them with PPE.
But wasn't HUD doing...
providing them with laptops.
HUD was doing this. And even PPE, we could purchase it under FEMA, which is unlimited. This is a limited fund, and it's just coming up with...
But the question is, can the money be... You had limited money from HUD, right? You had $35 million.
Correct.
You're talking about $103 million. My question is, could you have used any of that $103 million on some of the things that you used HUD money for to broaden those programs, like rental assistance, economic development, food banks, facility improvements, health services, mental health and substance abuse, providing assistance to schools so that they could safely reopen, right? Providing kids with laptops, for example, for remote learning to help them do that. Child care and youth services, senior services, provision of additional PPE in the community, housing counseling, public assistance. We could have used that money for those things, right?
Some of them, I believe so, but some of
instead-
them wouldn't make sense to me. I mean, if
Mr. Broderick,
FEMA, well,
instead, we chose to use that money to pay salaries and fringe benefits. By the way, the salaries and fringe benefits that we paid, those weren't additional expenses incurred by the county, correct?
no, those were
So
correct.
those are salaries and fringe benefits that we would have had to have paid anyway.
Correct.
Right? Because when Mr. Persich testified before us 8 days before the end of the year about the $20 million transfer, we asked specifically the question, hey, if we don't approve this transfer, will anybody not get paid? And the answer to that question was no. Right? So there's not a single county employee that wasn't going to get paid because we didn't approve a transfer of funds so that they could use CARES Act money to pay salaries, right? So we're not talking about reimbursing any county employee for the time that they spent in pandemic response that was tied to this CARES Act funding, right? They would have gotten paid anyway. The salaries would have been paid, the fringe benefits would have been paid,
Believe so.
right? So we're purely talking about trying to fix our budget, right? Because, as Mr. Persich, I'm going to have trouble with this all day, because we're at limited time, had testified, you identified, the administration identified, at the start of this pandemic, the CARES Act funding that we were going to receive as a budget gap closing measure, right? That was the plan, right, Mr. Persich? That was the plan all along.
That has been the plan all along.
But the plan changed, didn't it, over time? Right? For example, right, we spoke about $116 million in surplus funds from 2019. The plan, when you identified a $385 million budget shortfall, the plan to close that budget shortfall included using $116 million from the prior year's surplus to help close that gap. That was part of the plan, right?
That is correct.
How much of that $116 million surplus did we in fact use? I can answer that. Zero, right? So the plan changed. So when circumstances began to change, why, for example, did we not use the $116 million surplus and use the $103 million in CARES Act funding to provide fast and direct economic assistance for American workers, families, and small businesses?
Well, can I just, I think part of what we have to realize is the timeline of how things were evolving, meaning that we didn't know in November how strong our revenue side of the equation was. So you have to take that into account. We didn't know where we were going to finish the year at. I didn't know it was going to be $75 million. I can honestly tell you that. So
you knew it wasn't going to be $200 million.
But
right?
let's just suppose for a second that we didn't use the $103 million for salaries.
Mhm.
What would happen to my surplus then?
You used the $116 million that you knew you already took out of your plan.
And so then I have no fund balance left for this year, which is a very dangerous thing, which is what I've said previously, is to exit or get the county's on shaky fiscal ground. It's not like we're getting there, and I think it's a coordinated effort to methodically get the finances back to where it needs to be. But these moving parts were dynamic at the time of the whole thing happened, and there was a lot of funding, other funding sources that came in outside of the CARES funding that was identified in the presentation. And the other thing too, getting this out to the people is going to be very, very difficult based on some of the restrictions and how the charter is written, state law is written, and how we get it out. And moving forward, it's going to, it'll be a challenge for us to do that. But that being said, we did finish the year with a $75 million surplus related to one transaction that put us on the plus side. Negative is not good for me.
With all due respect, Mr. Persich, it's not just one transaction. You keep pointing to the 65 or $70 million savings from the NYFA transaction.
Correct.
Right, for the bonding
Right.
transaction. It's 116 million, right, from the prior year's surplus that wasn't used, that we took, and instead of using it, we put that right in our pocket. Right, now we're talking about $103 million, $98 million of which we used to pay salaries and benefits that we would have had to pay anyway. We took that, we put that in our pocket. But you also had different changes in revenue. You had greater revenues coming into the county than what you had initially forecast, correct?
No, I would disagree with you. We had, some of our revenues came in higher, others came in lower. I'll go back to departmental revenue. I mean, legislative, let's put it in buckets. And I use the term buckets, which I know is, but, our revenue streams come from, let's say, 3 different sources. One is from our sales tax, the other is our property tax, and then the last third, I'll say, is made up of state, federal aid, and local departmental revenue. For instance, red light cameras. That side, if you looked at how we finished the year, we were down $300 million. I mean, just on a budgetary basis to what the actual results were. A myriad of things happened. You are correct. There was a lot. It was a dynamic situation.
Mr. Persich, you didn't look at those buckets in May when you created, or the administration created the gap closing plan, and then not look at it again until the end of the year, right? You looked at those buckets continuously throughout the course of the year.
Correct.
Right? And in fact, you prepared monthly budget reports. Is that not correct?
That is correct.
Okay. And those monthly budget reports would have forecast based on the information that came in that particular month on where we thought we were with respect to the county's overall budget. What were the shortfalls? What were the areas of surplus? So that not only the administration, but also this legislature could turn around and make decisions on how we can handle the county's finances, right?
Correct point.
Okay. So, and by the way, how are those monthly budget reports actually prepared? Do the individual departments issue reports to your budget office? How does that happen?
How the process worked
Right.
is, well, the reports are required on a monthly basis as a result of the control period. So we're required to do that.
So they do NIFA also?
That's the
So
whole reason.
NIFA's relying on
NIFA
those
is using
reports to make
our data for what they're presenting, or what we're presenting. So my department with my staff, everybody has its own little departments, and we reach out to the departments and ask them for their input of what's happening, and we do our own analysis to turn around and say, this is what we think the department looks like throughout the year. So it's a coordinated effort, you know what I mean? We do what they call projections of forecasting, which is just, exactly what it sounds like. We forecast where we think things are going to happen in the departments, and that's the timeline. The report is issued on the 21st of every month, as is required by the NIFA statute, and that's kind of in a nutshell, an overview of how the department functions.
So when you testified before us on December 23rd, the monthly budget report for December would have been issued on December 21st, right?
No, that's incorrect. It's
All
the
right,
previous
when would
month.
it have been
And the monthly report issued was the November report. The December report, which is the year-end one,
Right.
which is the year-end financial close, which, is still subject to audited financial, the Controller's Office, gets published either late February, early March. This year it was March 1st. Because the timeline keeps moving because we have collections of revenues from other agencies that come in, particularly sales tax.
So now we're relying on these budget reports to make decisions. Us, NIFA, the controller is also relying upon these reports, right? Who else relies upon them?
The report is issued to the 3 agencies. It goes to NIFA, goes to the controller, it goes to legislative budget review, and that's it.
And we do our best to provide an accurate forecast of where we are in each of those monthly budget reports.
Correct.
Can we explain why between the November 2020 report and the December 2020 report, the one issued immediately before we made a decision with respect to the remaining CARES Act funding and the one immediately after, forecasted almost a $460 million budget variance between those 2 months?
Well, I think you have to look. Part of what we did in the December report was we took into the actions, the gap closing actions. So we didn't do that in the monthly reports because we weren't sure where everything was going to land. We had a $385 million gap, I'll call it, and then what we did was had a gap closing plan. When we closed the books and records out, when we knew everything was done, we then showed part of those gap closing efforts into the plan. Now, what changed? One of the things that did change was the NYFA transaction was supposed to yield $70 million. After we got through the transaction, it only yielded 52. So, part of it is, some of our debt, we didn't know where the debt structure was going to land. Those were complete variables out there. That could have priced that, the transaction could have yielded, let's say, 30 million. But it was it's a moving dynamic report when it comes down to it. But to get to where you're getting to, how we went from 385 to 75 was we took all the gap closing plans and some other things changed according to our gap closing plan, including sales tax being higher than what we originally estimated.
But we, for example, and just highlighting a few, general expenses, we had a $7.5 million positive variance. Contractual services, we had a $13.5 million positive variance. Interest, $16.8 million positive variance. And then I find these two things that are interesting. We spoke about sales tax and departmental revenues. Departmental revenues, we actually had a $37.2 million positive variance in departmental revenues. Were any of these positive variances forecast in any of our monthly budget reports prior to December of 2020?
I will say that our revenues were projected conservatively, where we took it down in I think it was May or April of last year, where we decided that with the impact of how this pandemic was going to hit, we took our revenue streams roughly down by 50% in the second quarter, 25 in the third, 25 in the fourth. Now, were my projections spot on for some of those numbers? Nope.
Well, they never changed.
Well,
right? I mean, from the time that we dropped those expectations at the start of the pandemic, they never increased. Did we not know from our departments that they don't report what their revenues are on a monthly basis?
No, I think some of the numbers did move because of some additional funding sources that came in, but some others' expenses went up and everything else. I mean, like we got FTA money for the buses. You know what I mean? That was a $33 million infusion of funding that was going to be cut because the STOA money from the state was removed. So that we accounted for. Remember, we also collect fare boxes on the buses. That was down, and I mean, the ridership was down.
No, I understand some was down,
so
but obviously we didn't magically generate $37.2 million additional dollars in departmental revenues for the 30-day period between November 21st and December 21st. I mean, that was accrued over a period of time. Why did we not know that in our monthly budget projections prior to that?
I have the number differently, legislator. I don't want to debate it with you. I have it down 29 million. I don't know what it was in November, but all my revenue streams, if you look from interest on penalty and taxes all the way down to what we collect, most of them are all negative. So how I forecasted them, the certain areas were better. The clerk revenue came in much better than we anticipated. We tried to reflect some of those changes because of the strong housing market and filings. But, look, until we collect the money, we don't know where it's going to land.
Let's talk about something that's a little less speculative then, right? The sales tax revenue, right? Because we do receive sales tax money in a couple of times a month, don't we?
We get 3 checks a month, I think is the correct amount every month, but they come in. Remember, it's not on our calendar year. It's on the state calendar year. So
Understood.
It comes in. So we have and just keep in mind that the big checks that we get come in the last few checks because they're related to the holiday season, which is that's the time frame that a lot of the majority of the checks are collected. So that said, we were conservative, maybe a little too conservative, but it could have went the other way too.
We knew we were a little too conservative, and we knew we were a little too conservative all year long, right? I mean, at no point we forecasted that we were going to have a 20% reduction in our sales tax revenue. And correct me if I'm wrong, but in no single month, even while there was a full shutdown of our economy, in no single month were our revenues down 20% year over year?
Yes, they were actually, legislator. In the middle months when we got the, remember, it's a lagging quarter indicator. When we got I think the May, June, and July checks, they were down almost 40% in those time frames.
Right.
So,
and then they bounced back up for the third quarter, right?
And they did, which is not the worst thing, and it's a good thing. But the other problem we have is that it's based on consumer spending habits, and thank God people had the money and afforded themselves to have money to spend. But it is contingent upon economic activity, and the other part of it is that it's still down 8%, which is I think the largest single number that I can remember in my history here, that's how low sales tax was. The other time was back, I think it was 2011 or 12, that we had a steep decline in sales tax, but nothing like this.
But just a month before you came to testify at the legislature, we were still forecasting that we were going to be, if I'm reading this correctly, at $921 million in sales tax revenue, as opposed to what we ultimately wound up with, which was almost 1.1 billion in sales tax revenue. That variation was $160 million. Did we not realize in between that the numbers were coming in better than forecasted? We spoke about this on December 23rd. You analyzed that it could have come in based on the numbers. If we finished out the year as it was looking, we were going to have between $100 and $120 million more than we thought we were going to have at year end. You didn't want to count on that because who knew what was going to happen in the last 8 days of the year? We disagreed on that, but that's what we were told. So were we not able to forecast that any earlier than December of 2020?
I would say no, because again, I'll say that those last checks that come in the subsequent year from January to February are rather large checks, and the holiday season clearly is one of the big components of that. I will not disagree with you. Conservative we were, but that's part of what the function of what we have to do is not to be, to make sure that we have enough money to pay the bills. And it was better than we thought, and thankfully so. You know what I mean? Thankfully so. But again, like I told the presiding officer, we don't know how much money we have at the end of the year until the end of the year closes. So you can't spend what you don't know. So it's kind of hard to get to the point that we knew we were going to finish with a huge surplus like this.
But if we're making decisions based on the monthly budget reports that you're providing us, isn't there an estimate to make them as accurate as possible? I know you don't know what you don't know, but the whole point of these forecasts is to try to accurately predict trends so that we can have information to be able to base our decisions upon, right?
Correct, and we do, to the best of our ability, present accurate numbers.
And you would concede that being off by almost $500 million from one month to the next is a pretty big variance, right?
No, I disagree with that. We weren't off by $500 million. Like I said,
well, there's a variance of $460 million.
No, I think for consistency purposes, when we reported the numbers, what we said was we were sticking that we had a $385 million gap, and we had a $385 million gap closing plan. So when we closed the books out and we reconciled all these other monies that came through, we then put it into the report and showed it as such. So I don't think it was a $500 million swing. It was maybe a little bit more because the sales tax came in a little higher and that we didn't use the fund balance.
Well, let's talk about state aid. For example, one of the concerns that you raised to us was that you were forecasting that we were going to lose about $130 million in state aid.
Correct.
That was as of December 23rd, 2020.
That is correct. And
the December 2020 actual state aid numbers came in with another $100 million variance, that we only lost $30 million and $33 million in state aid, as opposed to $130 that you told us 8 days before year closing.
Well, the truth of the matter be told was that the state budget office, when they issued their executive orders from the governor, was he had the ability to cut 15 and 20%. That guidance changed January, after we had a conversation with the New York State Budget Office, and they said we're looking at a 5% decline in 2020 and in 2021. That's what the guidance came out. It came out in January. So they said 15 to 20. I had to take them at their word. The fact that changed, yeah, but I couldn't predict that. You know what I mean? I couldn't say how. I don't know the state budget, what the finances are, but that's the guidance they gave us.
When the monthly budget reports are prepared, other than yourself, who's involved in the actual preparation?
It's me and my entire team. So we're the ones who do it. The DCE of Finance is involved. We look at numbers, we analyze, we do all our analysis. You know, it's an independent review by my office to do these things.
And is any guidance given to you by the you're part of the administration, but is any guidance given to you by others in the administration, for example, the Deputy County Executive for Finance, as to what numbers should be reported?
We do collectively. I give them an overview of what the numbers look like, and we have a collective meeting right before we issue the report to say that.
And are you ever instructed to increase or decrease those numbers based upon?
We're not instructed to do anything. We report what we have, and we present that as such. So we're not manipulating data. So
because I'm a little concerned that we're acting off of information that we're provided, and that there is a $460 million variance, which we find out about less than a month from December 23rd, 2020, when we ultimately were making decisions with regard to what we were doing with that last $20 million in CARES Act funding. Had we known at the time that we were going to be flush with cash, that would have left us with a $75 million surplus, I think a lot of us would have been more comfortable providing our constituents with services that they could have used. Those businesses that you see closed, right, in your neighborhood, and you're concerned about because that's going to impact our revenues coming from this year, wouldn't it have been nice with more accurate forecasting to have provided direct assistance to some of those businesses so that maybe they wouldn't have closed, right? Their doors would still be open today. People that have lost their jobs, providing them some assistance so that they can continue to pay their bills. Folks that are in need of rental assistance, it would have been nice to be able to provide them with that assistance to help them to help them pay their rent. The restaurant recovery program, as wonderful as it is, there are a lot more than 171 restaurants in Nassau County that we could have provided assistance to, and yet we didn't. And we didn't because the information that we received from the budget office and the information that we received from the administration was that we had a $365 million budget hole. In fact, the testimony on December 23rd was, hold on, let me see if I can get it. Was, let's just say if I don't move 20 million, then we're short 20 million on the operating budget as a result of this. So we'd have to absorb that amongst many other expenses and revenue shortfalls that we have. It's a very big risk to take from my perspective because we have a plan in place on how we're going to spend the money. It's just because we need a budget appropriation to do that, and that's why. You testified that it was the worst budget that you've ever seen. You testified that you still have a substantial budget deficit on December 23rd. If we had known at the time that information was inaccurate, we might have been able to better appropriate that $20 million to provide direct assistance to our residents, just as the CARES Act says, to provide fast and direct economic assistance for American workers, families, and small businesses. Instead, we held on to the $116 million, right, that we were supposed to use as part of the plan. We held on to 95% of the $103 million in CARES Act funding to pay salaries that we would have had to pay otherwise to help plug a budget gap which never existed, apparently. And now, we're patting ourselves on the back for showing a $75 million surplus, which, as Legislator Ferretti indicated, in a normal year, I'd be thrilled about that. But in this year, when so many people were so desperately in need, and when governmental money could have been used effectively in trying to help save families, help save businesses, and help save lives by providing additional testing, additional food assistance, and the wide variety of things that we spoke about, I would have loved to have had the knowledge to be able to put those funds to better use, and we just didn't have it. And whether it was inaccurate budget forecasting on the part of your office, or whether it was I hope it's not, a more sinister attempt to conceal information from the legislature, from NYFA, from the Comptroller's office, so that we would make decisions that fit what the administration's plan was based on the information we had. I don't know, but it would have been nice to have accurate information so that we could have made decisions. Yes,
Legislator?
One final question, because I know we're running out of time. By the way, when you prepared the lists of expenses that the 98 million was going to go towards, when were those decisions made? In other words, did we actually know prior to the drawdown of the funds at the end of December 31st of 2020?
Good question.
Did we know which employees were actually
Yes.
used?
Actually,
for
legislator, just to, and points of clarity, you had mentioned, spending the CRF funds. Initially, we had to spend, or any recipient had to spend the money by December 31st. So that was a limiting factor. If you didn't spend the money by the 31st of December of last year, you would have to revert the money back to U.S. Treasury. However, on December 27th, they issued an extension of their guidance to say, you can, if you didn't spend the money, you can hold on to it and use that money for eligible expenses in the following year, 2021. But to answer your recent question, yes, we queried departments to say, for department heads to identify individuals that were substantially dedicated to assisting in remediating the effects of the pandemic.
And when was that done?
I would say probably about June, July.
If I can just ask then, I have a memo to you, Mr. Broderick, from the Department of Consumer Affairs providing a breakdown of which employees were used for COVID purposes, for
Right.
the use of CARES Act money, that's dated January 5th of this year.
Right.
Is there a reason why? I mean, at the time that we approved the additional $20 million in CARES Act funding, were we seeking justification for that $20 million after?
No,
the fact?
what had occurred is we reached out to departments initially to say, is it more recent, back in June, July, to say, identify those individuals in your department who were substantially dedicated. So it wasn't just assuming that everyone was working on COVID, because probably not the case in any department.
You just said that was done in June and July, right?
That's correct, I did say that. So then, we went back to them and said, okay, now, here's what they were doing, right? Or tell us, what were they doing? You identified these individuals back in June, July. Tell us, what were they doing? And they came back to us with the letter to say they were doing X, Y, and Z, which is related to COVID remediation.
But didn't we have to certify to the federal government prior to December 31st of 2020?
No.
Who was being used?
No.
When did we have to provide that information?
We didn't have to provide the Treasury with that information. We had to give them, in the various categories that we reported in our presentation, those are the categories as established by the U.S. Treasury, to say, categorize your expenses in these categories. They're not like financial categories. It's not a financial statement. It's just saying substantially dedicated. How much money was spent there? It could have been in salaries. It could have been in fringes. It could have been in OTPS expenses.
But now you're saying that we can now actually exhaust this money in 2021?
That is correct. And now guidance was given to us in December 27th. Okay. It was after the fact. So it was either we utilize this money and leverage the money, or give it back to the U.S. Treasury as of the 27th, but as since the guidance has changed.
So
yet
in
again.
theory, we can take that $75 million surplus, which was from allocation of CARES Act money, and we can actually use it to provide assistance to families and businesses and PPE now.
I would say this, legislator, now that we know where we're at and as a result of, and when we get final numbers, we then have a path forward, because I don't know where these other funding sources are going to, sooner or later that those funding streams are going to dry up, the outside ones. We now have the ability to protect our residents with the addition of fund balance to move forward when some of these revenue streams dry up. And our plan has always been to spend that money. Once we submitted the plan, it deviated a little bit from what we originally thought we were going to do. We're not perfect here. By no stretch of the imagination will I give you the illusion that I can target the sales tax number and hit it on the head.
No, I get it, but it's just, it strikes me that half,
Can we sum up? I mean, we're 15 minutes over already, so.
Sorry,
Maybe
just-
one
it
last
just-
question. Legislator Rose,
Yeah,
Legislator Walker's been waiting patiently.
It just strikes me that being almost $500 million off is a pretty big variance for a department whose job it is to accurately forecast information so that you can make decisions based on it. But that's it. Thank you, Presiding Officer.
Thank you. Legislator Walker.
Yes, I have a question regarding, I know that we did not, evictions were not allowed, so you didn't need to help those residents who might have been evicted with rental payments or whatever. What about the landlords who own those rental facilities? I mean, some of those rentals are in, small little businesses, and those businesses were obviously hurt. So that business, not only was their business suffering, but income that they expected wasn't coming. And sadly, many of these people were ready to be evicted before COVID, and unfortunately, then everything came, the state mandate came down, and now, it hurt businesses, it hurt landlords very much too. Have you been able to do anything, or could we do anything to help them?
I'm going to defer to Kevin because he did mention the rental assistance, but it was more on a rentor as opposed to the landlord side, who was equally impacted on the other side of the equation.
Yes, as I mentioned, we have the homeless prevention program under the Emergency Solutions Grant Program. That the COVID funding under that program is difficult to run in a normal year because the income restrictions are very low. The income restrictions are up to 30% of AMI, of area median income. So we find that a lot of residents who are impacted, who are not able to pay their rent in a normal year, their income is still higher than the allowable amount. Thankfully, under the COVID funding that we received, that income level went up to 50% of AMI. But again, that's the program that's impacted by the need to demonstrate that the person would become homeless through an eviction. So an eviction, filing of eviction is still required under that program. So that is a lot of funding we have set aside, waiting for the moratorium to be lifted. We did also, in the second round of CDBG COVID, set up a rental assistance program that can be used to pay for rent arrears. There are some difficulties with that funding as well, because that's an ineligible expense ordinarily under the Community Development Block Grant Program, except for payment of emergency assistance, and it's limited to 3 months only. Again, which is one of these quirks of the federal government. They allowed us an extension with that. We could go to 6 months, but then that would trigger a requirement that we have visual inspections, and if there's any chipping paint, we have to prepare the paint. So we opted not to extend it to 6 months. That program is open now. That's a 3 months arrears requirement right now that's open to anybody at 80% of AMI. There is right now no assistance dedicated to landlords specifically, but the intent is obviously if the tenants are able to pay their rent, if we can make them whole with their rental assistance, and the ESG program allows us to go to 12 months of rent arrears. So that is a significant portion of back rent that can be used to pay landlords. We have had discussions. The Community Development Corporation of Long Island is running that block grant funded portion for us. Some of what they're seeing is that tenants are coming in. They have been, thankfully, trying to pay their rent. So they may not be behind in 6 months of rent arrears or 4 months of rent arrears. They have paid portions of several months of rent. So we're trying to work out the quirks in the regs to allow us to pay up to 3 months. We'll take those 3 months that have the largest balance of rent assistance. So that's rolling out. Just over the past, I would say 2 months, we were apprised of another funding source that we received funding under, and this has been very fluid. The U.S. Treasury Department is providing rental assistance program funding, and municipalities throughout Long Island and New York State were eligible to opt into that program. We decided to opt in. That's going to be administered by our office as well. The amount of money dedicated to Nassau County is small by comparison. It's $1.8 million. And I'm hopefully going to be here later today to get the supplemental appropriation for that. I don't know if it's going to be on the addendum or not. So I may see you at 1 o'clock. There is funding also dedicated to the 3 towns in Nassau County. So the town of Hempstead, the town of Oyster Bay, and the town of North Hempstead are receiving shares as well. So I believe that Nassau County's portion, even though it's not specifically addressed in the guidance that we have, is to be used for the town of, the city of Glen Cove and the city of Long Beach, those 2 areas that are outside the townships. The other 3 towns are determining how they're going to run their own programs, if they're going to outsource it or do it in-house. I've been speaking over the last couple of months with pretty much every town on Long Island, because there are 5 towns in Suffolk County that are receiving funding, as well as the county. I've talked to Westchester County, Yonkers, Dutchess County, Orange County, all of them receiving allocations. Everyone is trying to figure out how they're going to run this program. It's a large amount of money. It's obviously a huge need, not only for the renters to make sure that they're able to stay in their homes, but for the landlords to make them whole, to make sure that they can collect the back rent that's owed to them.
But basically, this money would go to the renters, and then...
Well, actually, the way the program works is the money goes to the landlord to pay the renters' arrears. So the landlord will receive the funds. But it's to make the renter whole so that they can
now, would these
pay the rent
renters
arrears.
only be renters that are in HUD housing or whatever?
No, specifically under that program, those persons who are receiving Section 8 rental assistance or are in public housing would not be eligible because their portion of the rent should be adjusted anyway. So if they see a loss in income, the Section 8 program should pick up that difference. So they shouldn't be in rent arrears. It's those residents who are in private housing that are impacted by that. And it is still income capped. The CDBG program is 80% of area median income. The Emergency Solutions Grant Program is 50% of area median income, and then the new Treasury money is 80% of area median income as well.
And it would be up to the renter to reach out for this, or could the landlord reach out because the renter is not paying?
We're trying to do a little bit of both. It's technically up to the renter to apply, yes, but I have spoken to a couple of larger landlords who understand that it's going to be a hard position for the renters to be in. They're going to assist them with applying for it. And Community Development Corporation does that as well. They have an online portal where people can apply, but they also are able to assist applicants to fill out their application over the phone. So we're working at it both ways.
Thank you.
You're welcome.
Do any other legislators have questions, either here or remote? I had one other question. Oh, I'm sorry. Legislator Dirigi.
Legislator Drucker had to leave time-wise, but I want to just mention that I'm glad we're in this position where we have a surplus rather than where I was worried we were going to be, which was trying to figure out ways to fix our budget at this point. I was worried about us losing funding for anything that wasn't mandated. I was worried about layoffs. I was worried about everything. So being a Monday morning quarterback, there might have been a few adjustments we could have made had we known all the information we know today, but we all know that we did not know that information at the time. And again, I thank you all for getting us through those rough waters and bringing us to where we are today. And I feel that it's a safe economic situation for our county, and probably the best we could have expected. So thank you.
I have one question, but before I do, I just want to respond. This isn't Monday morning quarterbacking. As a matter of fact, if you look at our hearing transcripts going back to August, this was Thursday morning, this was Friday morning, this was Saturday morning, this was Sunday morning. We've been going at this for months. So this is not something we brought up now. It's we've been probing and questioning the administration's projections probably since August. So be that as it may. The other question I had is, was any portion of the CARES Act money spent on mailings?
On mailings?
Yeah.
I believe so, yes.
Do you know how much?
Not off the top of my head, no, I can't say.
Can you get that to us, Paul?
Absolutely.
All right, thank you for the presentation. Thank you for, patiently answering all the questions. We appreciate the time that you put into this, and again, thank you.
Thank you,
Katie,
legislators.
Just want to, it's 12:30 now. Maybe if you could tell the administration witnesses and presenters that probably 1:30 will start. Okay, thank you.